Hello to all of you. Myself, Dr. Kanchan, physiotherapist, uh, currently in Jyoti Vidyapeeth Women's University. Today, we will have one of the important topic in our lecture, that is the core part in the physiotherapy. The topic is assessment. So today, this is one of the most core element in our either the site of treatment part, either we are acknowledging the condition of the patient. So today we will go through toward three things: the first, second, and third. The first one, we will have the definition of physical assessment. The second thing, we will know about the importance of physical assessment. The third thing, which today we will discuss about the goals of physical assessment. So this is the outline which we will discuss today in the lecture: the assessment part, the definition of physical assessment, importance of physical assessment, as well as the goals of physical assessment. If we are talking for the part of assessment, so this is one of the we can say the fact by which we can know actually what is the condition of the patient. We can gather all the information, we can collect all the information about the patient's condition, and this also give us view about the diagnostic procedures, test as well. It helps us or we can say it plays important role toward when we are planning the protocol or the framework or design of our treatment. As we can also say, assessment is one of the backbone part when we are working for the recovery of the patient. Why? Because each of the recovery procedure is depend upon the assessment, as this is one of the initial part when we are working for the that recovery or the treatment. So first of all, when we are coming for the assessment part, that is one of the comprehensive process. It is one of the comprehensive process which includes sometime the subjective data, which includes the objective data, as well as we will have the documentation and other facts regarding to the status of the patient condition. So the first thing, the assessment is divided into two parts. The first one is subjective and another one is objective. When we are going for the subjective part in the assessment, this is where we are gathering all the information of the patient regarding to first the about demographic data, the second one is when we are working for the history of the patient condition. The third one is the lifestyle of patient. Fourth one, the fact over which we will work, that will be the goal of patient or the expectation of patient from the physiotherapist, right? So we can say the assessment is divided, the core assessment is divided into two parts. The first one is the subjective assessment and the second part is the objective assessment. When we are going for the subjective assessment, we are having the demographic data, we are having the history of the patient and the next step we will work over the lifestyle of the patient. Then at the next level we have to focus over the goal of the patient, which is to be achieved by the physiotherapist or by the physiotherapy management. So these are the things which will have in the subjective part, the demographic data. First we will take the subjective part. In the subjective part we are having the demographic data. In the demographic data we can also say that personal details. We can also say that the personal details, these personal details conclude the name, age, gender, occupation of the patient. So let's we have the name, age, gender, as well the name, age, gender, as well we are having the occupation of the patient, right? So this is the first thing which we are acknowledging by the demographic data. So come to the part of the history of patient condition. Now one of the fact where there is having a vast confusion level, either we are working for the history of the patient or we are going for the history of the patient condition. So the right answer which we have to focus, which we have to put in mind, that is we have to focus over the history of patient condition, not in the patient's other life managements. So for the part of the history we will have the present history, the past history, medical history, as well as we are having the social history. Okay, so social history basically includes the family history. The first thing, come to this part, when we are going for the history of the patient, we are having the present history. Second one, we are having the past history, and the third one we are having the social history. Another one we are having the medical history. So these all are indicative markers of different aspect of patient conditions. From here we can have the identification of the patient condition by which the patient is suffering at the time. Again, I'm revising this. In the present history we can acknowledge the present condition of the patient by which he or she is suffering. Then past history, when we are working for, when we are taking the past history, under that we are having the contents like the previous surgery, the previous injury, any type of previous one or any type of previous pathology by which we can correlate, we can connect the present condition, either that is relevant or not. So come to the part of social history. Social history, that is comes under the contenting when we are taking the family history, like that particular disease or the condition have been came from the previous existence, like hereditary or not. The another one is the medical history, like some of the patients are taking previously many of the medications of like comorbidities, like we have the thyroid, we have the hypertensive drugs and many more. So we have to acknowledge the medical history during when we are planning the framework of the protocol. So this also we have been covered, like the history of the patient condition. Now come to the part of lifestyle of the patient. Okay, why we are seeking the lifestyle of the patient? Because when we are making a frame, when we are designing a protocol of the patient, it will, if the lifestyle is having severe type of markers which can hamper the protocol or the recovery zone of the patient, that should be acknowledged by us so that we can have the changes or variance over that. So come to the part lifestyle of physical of the patient condition, who is suffering from any type of condition. So lifestyle, we can have the psycho-social factors. For example, the patient is handicapped, the patient is somewhere impaired, or sometime if the patient is suffering from long term illness. And many times we can also say that when the patient is having some type of mental disorder, in that condition the patient lifestyle can hamper by two of factors, like the psychological factors and the social factors. How psychological factor impact by the social factor, this is a big question. Yes, sometime when we are having some of the like unique we can say the disabilities or any type of unique behavioral disorders, or a different type of like aspect of life, then the community site is slightly change over us. For example, if a person who is handicapped when moves, the community having 50% of mindset toward the different type of behavior. So somewhere that social conditions, community can hinder the mental aspect of the patient toward the condition. As well, when the person or our patient is having a long term of disease, or he or she is suffering from long term of disease, the patient automatically goes 50% of patient automatically goes for the some type of mental disorders like hopelessness conditions, depression, anxiety disorders, and many more. So for preventing these things, we can also mark in our assessment part the socio-economical as well as the psychosocial factors. So these are the two factors which we can see in the lifestyle of the patient. So the last part or the outline of our assessment, that is the goal of patient. Some of people's, or many times we are seeking that the goal is to be decided by the insight of the patient, or sometime it is to be insight of therapist. Actually the question arises here, a therapist or the medical practitioner when preparing for designing the protocol, then we have to be focused, we have to be put in our brain the patient goal should be included under our framework of designing the protocol for easy recovery or better recovery. So the goal of patient is always that portion which is the priority of the patient, which he or she is wanting to achieve from the physiotherapy management. So whole the assessments of a subjective part comes under these facts or these scenarios or terminologies. You must include these all things under the subjective assessment of a condition, of a patient condition. So come to the next part of assessment, that is the objective part. When we are coming for the objective part, what are the things which we have to conclude? The first one is the observation. The first one is the observation. The second one is the palpation. The third one we are having the neurological testing, or we can also say in another word the sensory testing or reflex testing. The another one we are having the spatial test and spatial scales, range of motion, then physical examination. So these are the things which we have to conclude under the objective assessment of the patient condition. The first one is the observation, the second one is the palpation, the third one is the neurological testing, another one is the spatial testing or the spatial scales which we are concluding during the physical examination, and another one which is most important, that is the range of motion. So all these things we are having by the patient assessment. The first one is the observation. So what is the thing which we have to observe during the assessment of the patient? The first one is the swelling. If we can say anyone having any type of swelling, edema, or any type of tenderness over any type of condition, discoloration, which we can see by the observation. The another one is the palpation. In the palpation we will have either that is we will palpate, we will assess that swelling condition as well the tenderness condition. The neurological condition, neurological assessment, we have to assess the reflexes as well as the sensory testing methodologies to test or to assess the senses. Then spatial test, for each and every joint we are having the different to different spatial tests. For example, we are having the MTCAN test, we are having the various type of anterior drawer test, and various type of tests are there to check out the joint range of motion and the deficient portion. So another one is the spatial scales. Yes, it is also there, by which we can conclude how much the patient is suffering from any condition. For example, in the pain condition we are taking a common scale, that is VAS. Another one is the range of motion. Yes, it is the degree by which we are acknowledging the joint actually how much it is moving or not. Then the physical examination, inbuilt and all the appearance and all the thing where we can have the another thing in the observation only. One more thing we have to focus, the postural analysis and the gait proportions. This is also to be concluded under the observation part. Out of that subjective and the objective, we also have to go for the documentation as per the ethics, we can say the beneficiaries of the professional part. So all these things are short, all these things I have concluded in a short video of assessment, and over the details we will have the next session. Thank you very much.